Are you accidentally making pelvic floor dysfunction in your patients worse? Of course, we wouldn't do that on purpose, but sometimes the way we cue our patients to brace their core can inadvertently cause pelvic floor dysfunction. The reason that happens is your diaphragm, the top of your abdominal canister, is a very strong muscle and creates tons of intra-abdominal pressure. So if you tell your patient, brace your stomach tight, like someone's gonna punch you in the stomach, you're often holding your breath, pressing your diaphragm down, and putting undue pressure on the pelvic floor. For those patients who have stress incontinence, sometimes that can become exacerbated by bearing down and pressing hard down with your diaphragm. An alternative that's more useful is often to train the patient to engage their pelvic floor first and try to draw up the pelvic floor prior to establishing a full abdominal brace and then going through their core exercise. Of course, every single patient is different, and the best trained providers in PT to help these patients are those who've gone through pelvic training, especially those with an orthopedic background on top of it. So if you're unsure or you need additional advice, refer to one of your colleagues who's pelvic floor trained. In the meantime, instead of having them bear down, try to lift the pelvic floor first and then brace their core.